Jen Neary.
Administrative supervisor, benefits,
Yeah.
I wear 5 different hats.
She's our health insurance person here, so Matthew and earlier said I sleep and breathe and all that stuff, PPAC, and well, really Jen does, she knows it, and as Joe mentioned earlier, PIA, being a provider of the education, we will also be a shop certification provider. First one is, can a group work with both a navigator and a broker?
I mean, I don't know why they'd want to, but that's come up to me kind of the other way around. Can a broker team up with a navigator? I see no reason why not. Just the key is a navigator cannot receive commission from an insurance company. So any kind of partnership, you have to take that into consideration.
How much will navigators be paid?
As I said earlier, we announced the organizations that are going to get these grants. Okay? It's $135 million over 5 years that's going to be paid to these navigators. There's at least one, these organizations. There's at least one in every county. They are responsible now for hiring navigators. I have no idea what they're going to get paid. They're not going to get any commission. So they're not getting a head count. They're not getting it. That's, I would imagine most of them are going to be paid a salary by that organization. So, and that's part of their business plan. Figure out, based on the grant, what they can do.
Here's one kind of, I guess it's more about the structure of the navigators. It says navigators cannot sell, solicit, or negotiate, right? They're not really anything like a producer but an assister. The navigators cannot discuss and advise on plan design.
That's true.
That's correct?
Yeah.
Okay.
We are going to require recertification every 2 years. Now, whether that becomes an ongoing thing, I'm not too sure, but the real reason why we're doing it from the outset, as I said earlier, a lot of things are going to change in 2016. Just the community rating rules themselves are going to change. And then there's other steps within the ACA. So there will be a lot of things that a broker needs to know that we need to talk about. So.
We have long-standing relationship with the licensing bureau at the DFS. We're on the phone with regularly, kind of working out questions that come in from the membership, and I'll speak with my contacts there to see if they have any.
They've kind of laid this on us.
Oh, they have.
It's a kind of a systems thing. But
okay.
Yeah, but if you want to ask, go ahead.
Well, when we find out, we'll make sure everyone else finds out, and we, on our website, we even in the past have put calculators up where you can put your birth date in and you can see when you have to go. So we'll try to tie that in.
When Jennifer's teaching this course, it'll be figured out.
Oh, excellent, excellent. The CE credits for shop and individual exchange courses apply to BR and LA licenses.
Yes.
Yes.
How do brokers get their name on the system to pop up?
We're going to do that in the system when you come in certified, and I believe they're working on a couple of different options, whether it's going to be county or zip code but there will be. You can suppress it too. And the reason I say that is we did get some advice from one of the other states who said, yeah, you put all these brokers' names out there, and then John Doe wants to call them, and then the broker doesn't call them back. So we're going to really monitor that end of it too. And where it comes from. You've made a business decision. I'm not going to deal with any groups smaller than 5 and a group of 3, and so we got to know all that type of stuff. So there's going to be more than just area. There's going to be other things built into it. We're open to any suggestions, so send them your way and give them to us.
How will Healthy New York plans be affected?
Healthy New York is still going to exist for small groups. It is not going to exist for individuals anymore. And it's not in the exchange.
How will open enrollment work?
I mean, that's a good question. It's going to be from a shop perspective. The open enrollment for the individual, as I said, starts in October, will end in March. And that's, I think next year, it doesn't go as long as March. But don't quote me on that. I think it's a shorter period of time. But for the shop side, that open enrollment period will always be 30 days before your effective date. So if you came in April, it'll be March before.
Can an employer or employee keep their current plan?
Sure. When you say keep it, obviously they haven't come into the exchange, so yes,
Right.
Absolutely. Again, we are, on the shop side, we're a competitor. We're not. We're like a TPA. That's out. We're going to do the billing. We're going to have this website. We're going to do all these things, but we're just another competitor against, all the other small group programs that are out there.
How is the exchange going to deal with the smaller carriers with low rates? So maybe stripped down plans, I'm thinking.
Yeah, well, I mean, remember, anything that when we're done at the end of the month, it's gonna have essential health benefits, it's gonna have, you know, so the word strip down is not gonna exist, you know, inside the exchange. You know, I think you'll see on the shop side, there won't be too many small carriers.
Will the exchange have any effect on Medicare eligible individuals?
No.
What about group Medicare plans?
No, there's no Medicare at all in the exchange, and it won't affect it.
When are non-standard plans going to be available and the rates?
Again, that'll all be at the end of the month, and we will do a webinar sometime in I'm hoping towards the, you know, middle, late August, and just to give you an idea, we've done 2 webinars and have had over 1,500 participants, and that's just emails. I don't know how many people were in Matt's office listening to it.
Like 12.
So we've had, you know, we've had a lot of interest, and anybody who's been in that is in our systems, in our database. So the next webinar, you're just automatically invited to it.
Quick, going back to navigators real quick, will we be able to contact or partner with navigators to do a presentation to client groups in the seminar?
I mean, again, I go into that, you know, I can't, I'm not an attorney making rules up here about what's going to happen in, you know, in the exchange. I would think that that could be a good business practice, but again, you have to keep the separate, you know, you really got to separate the grants and the funds, and that's the key, to keep that separation.
Well, as Joe alluded to earlier, you know, his email address is up there, and I email him all the time. And he's a great guy to email with. So, by all means, email us at PIA or email Joe, and we can. We have a lot of answers, and obviously Joe has all the answers, or the vast majority of them, as we've seen. So again, thanks all for coming. This is fantastic to see the room filled like this. And as Matthew is showing here, he wants us to make sure to let you know that the shop certification, again, will be offered by us, and we'd love to see all the same faces. And we hope that we can prepare you all to succeed and work in the exchange.
Yeah, actually on the back of your packets, you'll find the registration form for the classes. And our first class we're hoping to roll out, I believe it's August 22nd. So any questions that you might have, again.
All right, thank you.
All right, thanks.